You've learned the technique. Now, how do you bring it into your daily workflow? Today, we're going to look at how regenerative therapies become seamless in a busy clinical setting. In this book, I talk a lot about how to apply what you've learned in real practice. You've already learned the injections. You've learned joint injection, visually guided. You've learned about peptides. You've learned about PRP and A2M and HCTPs or Wharton's jelly. You've learned about all these different types of regenerative medicine. Now, how do you actually implement that in your practice? What is the first step? What staff do I need? How do I schedule? What is the paperwork that I need? All of these different pieces of bringing in a new part into your practice. How do I market? What are the things that I can and can't say? What are the lanes, as I like to call them, when I'm bringing something in? How do I talk to the patient? So it's really about creating a bridge from knowledge to action, which builds value and aligns with what you're wanting to bring into your practice. That starts with your training, whether that's training in the skill set, training on how to market, training on how to ask for cash services, and then training on how to organize this to bring it into your practice, to be able to serve your community. So as a business owner and a medical provider, looking at bringing in new services, specifically regenerative medicine type services, it's essential that you as the owner and the provider, you know what regenerative medicine services you want to bring in. Having alignment is essential with your staff. Alignment with belief in the product. That means your staff is fully educated and agrees with what you are bringing in. And when it comes to regenerative medicine, you want to make sure you're having that conversation, educating your staff just like you would educate your patients, because when you aren't there, guess who is speaking with your patients? It is your front desk. It is the medical assistant. It is the office manager. So they need to be fully briefed and educated on whatever regenerative medicine treatment you're bringing into the practice. So at my injection training, you're going to learn the essential details when it comes to regenerative medicine and all the different types of treatment out there. What are the different products? Do they come from the patient's own body? Are they donated products? And what are the suggestions? What is best practice when you're looking at these specific types of products? Who are patients that are not candidates for this? Who are patients that are really good candidates and why? So in class, I go over in detail all the details of the different types of products, whether it's from your own body or it's a donated source, and some of the do's and the don'ts. And this actually is going to help give you that knowledge so you can make the best decision for your individual patients. And you're really bringing in the research and the articles and the background of experts into making the best possible decision for you, your practice, and your patients. I teach the hands-on course every single month. I've been teaching it for 12 years. Really, we just have a great time. And that's where we also love referrals. If you've already been and you want to share it with the world, refer us to everybody you know. This is for medical doctors, DOs, PAs, nurse practitioners. Those are really the 4 scope of practice that are going to be able to benefit the most with this type of training. So go to myinjectiontraining.com and scroll down and see our calendar. You can sign up for your course right there. And I'm always here. If you have any questions, shoot me an email and you can click on our website, and I'm happy to respond and happy to answer any questions you may have.